So the next medication is Ondansetron. The brand name is Zofran. The classification is an anti-emetic, also known as a 5-HT3 serotonin receptor antagonist. The mechanism of action: nausea happens in your body when it releases serotonin into the gut faster than it can be digested. Your brain then receives a signal saying that it perceives it as nausea. Zofran blocks the serotonin from binding with serotonin receptor sites. This prevents impulses from being sent to the brain and can prevent and alleviate nausea, vomiting. Indications would be to control and prevent the prevention of nausea, vomiting. It works well for people experiencing nausea from chemotherapy and or radiation therapy. It's not been found very useful for treatment of motion sickness, or it has very little effect on nausea from vertigo. Contraindications: any known hypersensitivity or allergy to Zofran, anybody that has a history of prolonged QT syndrome. It should be used in caution with patients taking other serotonin blocker medications, and it also should not be used in patients taking apomorphine, which is a drug prescribed for Parkinson's disease. Adverse effects: you can see some GI symptoms such as diarrhea and or constipation. Headaches, fatigue, drowsiness, and blurred vision may also be seen. Chest pain, which can be a rare symptom, but also you may see EKG changes, such as the prolonged QT syndrome. You may see some AV conduction disturbances with rapid injection. Dosing for adults is 4 milligrams undiluted, slow IV push. You may also see it packaged in oral dissolving tablets, which is also going to be 4 milligrams. For pediatrics, the dose is 0.1 milligrams per kilogram, undiluted as a slow IV push. Maximum single dose would be 4 milligrams. And for patients greater than 2 years of age, the 4 milligram ODT tablet, which is the oral disintegrating tablet. And then for anyone less than 2 years of age, you would half that as 2 milligrams of the ODT tablet. One thing to note is that it is easier to prevent nausea and vomiting prior to it happening. Once someone is actually vomiting, Zofran will probably have little to no effect on them.